Let me start by citing Marcel Proust and his hero Over the Bridge. We're contemplating about the future in the presence of the past. Why I'm saying that? Because things are evolving, they are in permanent flux. Minimal invasive heart surgery is the present and the future and is gaining ground. Why? Not only because we're so hot about developing new procedures in heart surgery, it's not the next feat of surgical ordealism. It's something the patients come asking for. 30, 40 years ago, at the beginnings of heart surgery, patients were praying to come out alive of a heart surgery theater. 20 years ago, patients expected more educated now, skills and technology improved. They were praying to come out alive and have no complications. Nowadays, we're in a new era in the 21st century. Patients expect to come out alive, to have at least possible complications, and to have the best possible cosmetic result as well as long-term outcome. So now patients Google everything, and they come asking for a minimally invasive procedure. And besides, minimally invasive has a lot of advantages, which I will allude to in a short while, and it's in the very compliance with the Hippocratic principles. So minimally invasive heart surgery intends to give you the same result, the same outcome, same efficiency, same safety, but with a less scar and many more other advantages. So with the new technologies in the field of heart valve and bypass operations, we can do these procedures with or without collaboration with a cardiologist through smaller cuts. So in the last couple of years, the greatest news is that the cuts are becoming smaller, the incisions, the trauma to the patient is better, there is less blood loss, less use of blood products in those minimal invasive procedures, less infections, less complications in terms of heart rate, arrhythmia after the surgery, and less hospital stay. So the economic aspect of heart surgery is a very important one. 1 minute in a heart surgery theater may cost more than $50. Keeping this in mind, and keeping in mind the cost of hospitalization in major cardiovascular disease, it's very key, it's very important to keep these aspects in your mind, to keep focus on these aspects as well. So the economical aspect of minimal invasive heart surgery is an important one. Patients go home faster. And I would, last but not least, it's not only that they go home 2 or 3 days earlier than the normal the median sternotomy patient. They go back to full functionality following discharge from the hospital in just 1 or 2 weeks, as opposed to 6 to 12 weeks following median sternotomy. But I would like to mention something. Our thoughts are not of absolute nature in minimal invasive heart surgery. That means not every patient is good for minimal invasive heart surgery. We try to individualize our care, but the patient has the right to know about these options and he has the right to choose. So the latest updates are of course in the area of transcatheter procedures, transfemoral and transapical procedures, which are very complex, and I would have to elaborate very long to update you on this. But there are 2 more new innovations that arise from our center, which we call CIMICS, single incision minimal invasive heart surgery. And the second innovation we think could have potential is the cardioscopic surgery. So if you want, I can elaborate a little bit more. CIMICS stands for single incision minimal invasive heart surgery. Of course, minimal invasive heart surgery bears some advantages over the classical way to do heart surgery. But still, minimal invasive heart surgery, for example, for the mitral valve, comes not only with 1 small incision, but it comes with additional ports, auxiliary ports. That means you need some more small incisions in order to introduce complex endoscopic instruments, such as the endoscopic camera, the cross clamp for the aorta, the left atrial retractor, and you also need an incision in the groin area in order to put the patient on heart-lung machine, on the cardiopulmonary bypass. Our procedure, we didn't really reinvent the wheel, but we have used existing technologies from the market in the context of minimal invasive, and we managed to eliminate all these auxiliary incisions. So no more holes in the chest, no more femoral incision, and the entire mitral valve surgery is now reduced to 1 single incision on the side. Therefore, single incision minimal invasive cardiac surgery. It did take us to develop a new left atrial retractor, though, which we have published in the Annals of Thoracic Surgery 2 years ago. A very simplified type of alloy consisting of steel that you can use to retract and open the heart, so you can have very good visualization of the mitral valve, which is of course much, much cheaper and equally efficient to some of the existing left atrial retractors. So that's the single incision minimal. Of course the patient appreciates this. We have a series of a couple of patients. They appreciate it because the scar is still smaller and they don't have the other incisions that are auxiliary and are usually utilized to carry out a mitral valve procedure in the minimal invasive setting. Now, cardioscopic surgery. Cardioscopic surgery etymologically arises from the Greek language that means skopeo, skopo, I'm looking inside, and cardio, heart of course, I'm looking inside the heart. It's a surgery we do on the arrested heart. The heart is stopped for this procedure through the apex of the heart, through the tip of the heart, equally to the transapical valve implantations. Only in our case, we do stop the heart for a short while, but by using endoscopes, we go inside the heart and we can address a lot of structures at the same time. This procedure, this methodology of cardioscopic surgery is currently in an experimental stage. We have done our first animal experiments and we have demonstrated them at the latest AATS meeting in Minnesota, United States, a few months ago with some good resonance. So what we do is we open up, we go inside the heart with endoscopic instruments, we have replaced or repaired the aortic valve, we have put in sutureless and other deployable valves, but also sutured valves, classical valves. We have done this in aortic valve position and also in mitral valve position. It's also a very good access to do arrhythmia surgery. For example, if you want to do atrial ablation procedures, you can reach the entire surface of the left atrium from inside through the very same port. So it may be a procedure that is promising for combined surgical moves, for combined surgical approaches within the heart in a briefly arrested heart. Out of instinct, I would think that procedures would get more minimal and minimal in the future. Now, this might sound a little bit paradox, right? Because minimal, it's the least possible minimal. It cannot get any more minimal. So etymologically, the term minimal, it may be wrong. So if we may want to use the term less invasive. So procedures will become less and less invasive. This is simply natural evolution of the surgical field. And it's not only about the future of the cardiac surgery procedure itself. It's the minimal or less invasive cardiac surgery offers a great platform for collaboration with the cardiologists in a hybrid setting. That means that by the cardiac surgery procedure getting more and more minimal, less invasive, they can be merged with cardiological procedures in the same session in the hybrid theater, which I believe builds the future of our métier. It includes more than 12 heart surgery procedures in combination with cardiological procedures, because patients tend to come with more advanced and multi-morbid cardiac disease nowadays, not only one valve disease or bypass disease, coronary artery disease, but rather combined diseases. And that's where I believe the future lies. Well, I believe the future is very bright indeed. In our division, we have introduced some structural and procedural changes that tend to show resonance already. So we distinguish programs, we accept fellowships, we can invite and welcome people from all over the world to train in particular things, rather than being dropped in a chaotic kind of system and swim around for 1 year and go back with some kind of certificate. We invite people in a structured fellowship program whereby they will know, beyond doing the standards of course, that they will spend 1 year or maybe 6 months doing something specific. Learning minimal invasive heart surgery, learning heart failure surgery eventually, aortic surgery and so forth. So in that terms, there is a lot to offer from our institution, and of course a lot in exchange with the World Society of Cardiothoracic Surgery. How? We have recently introduced the Asian Academy for Cardiothoracic Surgery, which can be a great synergistic platform with the World Society for events. We can set up events in a cooperative way, in a synergistic way. Young surgeons can come and train and in a meaningful way on either mannequins, They can train on cadavers and learn all these new technologies. This is the least we can do. I think that the minimal invasive platform, as well as our division, which of course focuses, among other things, on minimal invasive heart surgery, can contribute a lot, not only in terms of training the surgeon, but impacting the way we design the syllabus for the cardiac training of the future. I want to say at this point that I believe the future lies in a cardiac center, a heart center, not anymore in the traditional cardiothoracic and vascular surgery unit. Keeping this in mind, I think the cardiac surgery training will change in the years to come. With that perspective in view, I think our collaboration and synergy within the society, as well as the Asian Academy for Cardiothoracic Surgery, can do a lot and a lot of meaningful things. It's a very, very attractive venue. We're all glad we've been here. It's getting better and better every year, and we're all looking forward to the society reviving its potential and its reach across the world and implementing more and more technologies, more and more other groups in a synergistic way. We're really looking forward to the future of the society in its meeting.